Are your kids behind on their routine vaccinations? If so, you aren't alone. According to data published by WHO and UNICEF, 23 million children missed out on basic vaccines through routine immunization services in 2020. Don't worry, you can get them caught up. With tips on how to do that, we are joined by pediatrician Dr. Dina Kulik. Good morning to you.
Good morning.
Doctor, where should parents start? Is there a priority list when it comes to these vaccines?
It really depends where your child is at and how old they are. So I always recommend touching base with the child's healthcare provider to see how old they are, what they might be missing, what they might be due for, and then making a priority based on where they are at in their life.
So if you have missed a vaccine visit, can your child get multiple vaccines in one visit, or are there specific recommendations for how to space that out?
It's a great question. There are many vaccines that we give at the same time. So for example, the typical routine 12-month vaccinations and 4-year vaccinations, they come in 3 and 2. So there are many vaccines we can give together. There are some vaccines we want to separate out by a month or so, but many vaccines can be given together depending on parental choice.
It's quite dependent on your individual situation.
That's right.
Okay, what are the primary worries with seeing so many kids behind on their vaccines?
Vaccines help prevent vaccine-preventable illnesses. And as we've seen in the media the last couple of days, there has been a rise in cases of polio, for example. In the past, we've seen chickenpox or varicella, measles infections, pertussis or whooping cough. If we don't have many kids vaccinated or most kids vaccinated, we don't achieve that herd immunity we heard so much during the pandemic, and we're at risk of kids that are not vaccinated getting sick from these illnesses.
Doctor, what is the best way to make routine vaccines more accessible to everyone?
I think during the pandemic, especially, a lot of families were scared to bring their kids into the doctor because they wanted to avoid COVID and exposure to other illnesses. As long as kids are following up with their doctors or nurses for those routine examinations, that person can provide education about what is missing for your child and how to catch them up.
What about school-age children? We know that that was often an option to get your vaccines in school. What are you hearing about whether or not that's happening again this year?
For most of the country, the only vaccines that are given in school typically are the grade 7 and grade 8 vaccines, hepatitis B, HPV, and a meningitis vaccine. Most typically, these other vaccines are given by the healthcare provider. So your doctor or nurse can see where they're at and then, make sure that they are up to date.
Doctor, I have to ask, we've run so many stories on this show about how difficult it can be to get a healthcare provider for your family, or that perhaps your doctor only works 1 day a week and you can't get in to see them. So there are delays on that end as well. If you're struggling to find a healthcare provider for your family, what options are there for you to get your children vaccinated?
Public health facilities across the country will give vaccines for kids that are missing them. So you could always look online and find the healthcare center nearby to you or the public health center in your province or in your city. And there's various websites online that can help pair you with a doctor if you are in need of one.
It can definitely be overwhelming if you have fallen behind. So Doctor, I thank you so much for coming on the show to give us tips to get caught up.
You're welcome.